welcome. Good morning, good afternoon, or good evening. And I am happy that you are here with us. Whether you are a morning bird or a night owl, I am just so thrilled that you're here for the latest and greatest installment of the Richard Watkins Podcast. I have to welcome each and every one of you to it because this is where we sit down and explore amazing topics and amazing ideas with amazing people whose stories and whose research and whose efforts shape science, policy, and our community. Each week, we sit down with leaders and innovators so we can understand not just what they do, but why it matters. The Richard Watkins Podcast is a proud production of the Science Policy Action Network, the premier research, consulting, and engagement firm, whether you're a government, nonprofit, for-profit corporation. If you have questions about tomorrow, today, we're here to help you hold your hand, make decisions as this world of innovation is shaping everything around us. Now, with that out the way, we have to welcome today's guest. We have Dr. Meredith Collins, a postdoctoral research fellow in the section of Pediatric Population Sciences, Outcomes, and Disparities at Rutgers Cancer Institute. Dr. Collins' work focuses on helping children, adolescents, and young adults navigate the psychological impact of cancer through narrative and quality of life research. In this episode, we'll explore her career path, learn how she combines storytelling with science to support young cancer survivors and their families. Thank you so much, Dr. Collins, for being with us today.
Thank
So,
you. Thank you for
yeah, well,
having
tell
me.
us. Yeah, sorry. Yeah, I'm just so eager to get into this conversation. But before we start talking about the work, Dr. Collins, can you tell us a little bit about who you are, how you came to this research? Yeah, start us all the way back from the beginning. How did you come to do what you do now?
It's a great question. And I suppose that it would probably be best to talk about it chronologically, because that is just the way that it happened. So we'll start in July 1998, and that's when I was diagnosed with cancer. So I am a pediatric cancer survivor. I had acute lymphoblastic leukemia, and I was on treatment for about 2.5 years, and I've been in remission since 2000. And so I had this experience, and it kind of changed the rest of my life, the trajectory of my life. And it led me to research. It led me to the research I do in a very non-linear way. So I had that experience, and then I wanted to get back, like a lot of cancer survivors do, to my normal life, right? Like I wanted to kind of just not focus on this experience, move on, get back to doing normal things that normal people do. So that was kind of my plan, but when it came time to think about what I wanted to major in college, what I was drawn to, I knew I liked to read. Reading was something I did a lot while I was sick, before I was sick, after I was sick, all of the things. Like I did it all the time. Um, and so you can't be a professional, even though that would probably be something I would be really interested in. Um, and I am kind of now actually. But so I decided I was going to write. That was going to be my thing. So that led me to journalism, and I decided I wanted to major in journalism, and I started looking around for good journalism. I grew up in Northeast Ohio, and it was about an hour between Cleveland and Pittsburgh. So I was looking, primarily in the Midwest and the Mid Atlantic. And I ended up at Indiana University in Bloomington. And I mention that because while I was there, I had the fortune of meeting some really great faculty members who kind of encouraged me to think about grad school, about research as a full-time thing, as like the thing that I would do. And at first I was kind of like, I don't know, I'm maybe done with school, like excited to get back out into the workforce, actually get into the workforce and kind of just be done with school and learning and stuff. But I'm a nerd, so after about 3 years after I graduated, I was like, you know what? I don't like working. Not that I don't like working. I wasn't feeling totally satisfied in what I was doing. I felt like something was missing. So I was like, you know what? I'm going to go back to school. I'm going to try doing this research. And um, I have to admit, I was very naive about what I was getting into when I stepped on the campus of the University of North Carolina for my master's. But I figured it out. And while I was at UNC, that is where this research really came into focus. UNC and UNC, like the medical center, the medical school, and UNC Health have a really active program in adolescent and young adult cancer care. And so that spans, everything from the medical side, researching new actual drug treatments, but also the psychological side and thinking about the psychological kind of impacts and, care and how do we best support people who are going through this experience. So one of my advisors at UNC, who ended up being my doctoral, my dissertation committee chair, Dr. Lazard, was in my department at UNC Husman, which is the School of Journalism and Media. And we started working on this American Cancer Society grant that she received about peer-to-peer support using social media. So she was really interested in the idea of like social presence and how do we connect people who are going through this hard time, and how do we design an app to really facilitate that kind of communication. So we started working on this project and I started delving into the literature and I was really just struck at like how interesting I found this. I'm sure some of it was like, oh, this is what happened to me. But I just was really interested in like how to support people. And I realized that, this was like the third year. I had completed my master's, but had just started my PhD program. And I realized that all of the media effects, like all of the media psychology, which is what I was really interested in during my master's, like all of that could be applied to um, oncology. Because in media psychology, we're thinking about how do people process what they're seeing, and I started thinking, well, could we use how people are processing what they're seeing to help them cope with this experience? Like, is there a way to do that? And let's see, this was pre-pandemic, I guess, maybe like 6 months before the pandemic, there had started to be some like papers coming out in media psychology about eudaimonic entertainment media. So like media that like inspires us to a greater purpose. And so I started thinking about how we could apply that to cancer survivorship and helping people cope and just cope with their experience and help them, kind of formulate this new like post-cancer identity. And so that's what I ended up doing my dissertation on. So I wanted to know if cancer survivors were using entertainment media in this way. Were they watching entertainment and thinking about how it related to their cancer? And if so, what are they watching? Like what are they watching and reading? And I also wanted to know, could we inspire healthy peers to be better support persons? Because we know in the literature that, adolescents and young adults, they want support from their peers, especially like friends they had before their diagnosis. But it's really hard from both sides, right? The person with cancer is going through all of these things that are probably really hard for people who have never had this experience to really understand or like really kind of even wrap their head around. Because a lot of times it's, something you only see in movies, right? Especially for these young people. So it's hard on both sides to really know how to navigate that conversation. Um, so I wanted to know if if using popular entertainment could really help us um, bridge that or start that conversation. And that's actually led me to the project that I'm working on now, which is using one of those narratives to prompt supportive conversations between a young adult and a friend, and just starting to get that project off the ground. So I don't have any results on that one yet. But that is kind of how the whole thing unfolded. Um, with some abbreviation. So I'll let you kind of uh, take it where you want to go next.
I have, so many questions. And I guess, obviously, I think I should just start off with just saying, thank you for doing the work that you do. Um, because I imagine, as being a cancer survivor yourself, this work touches a big part of you. How has this work, touched you? How has it impacted you? What is it like being a cancer survivor doing research that is related to cancer survivors?
Yeah, so I'll first start with the joke, which is the joke that I always say is I tried so hard to not have anything to do with cancer anymore. And yet here we are. So to me, that's kind of a joke because I tried really, really, really hard. But these are the questions that I felt interested in asking. It was pulling me back to it because those were the topics and questions that I felt most passionate about. So I tried to get away from it, and for some reason, my mind didn't like that, and it just kept pulling me back in. And you know, I love that in many ways because it feels like it feels like I'm doing something like it was all for something, right? It was definitely a really, really rough experience for many reasons, as it is for most people. I mean, I'm not saying I had it any worse or better than anybody else, but it was definitely a rough experience. But I feel grateful that I'm able to contribute something, right? That I'm able to take it and help somebody else. And I feel like it's interesting. That's what I hear from a lot of participants also, is that they want to participate in research because they want to make it better for the next person. Um, and so in some ways that's incredibly gratifying because there's like this whole community of us who have gone through this experience, have lived through it, are on the other side and trying to do something for the people who are next, right? Um, so that's really awesome. In some ways, it also poses some method challenges because sometimes I have to stop and check myself and say, not everybody's experience is exactly like mine, so I'm basing maybe some decision I'm making off of my own experience, and I really have to step back and be like, wait, is my experience isn't the only one. So I really need to think about, does this align with the literature, or is this just something that, I experienced and maybe isn't the best decision based on what we actually know at this point in time. So it's kind of that insider outsider role. Um, and some of that is intentional. I was 7 when I was diagnosed, so I wasn't an adolescent or a young adult, and that's where most of my research focuses now. And that's actually a National Cancer Institute defined age range um, of patients between 15 and 39. So whenever I tell people that, they're like, oh, that's a really big age range. And it is, it's a huge age range. But basically, the NCI idea was that, you're a little too old for straight pediatrics. So you're probably not going to be entertained by Disney characters and, you know, other pediatric focused kind of things. And so on the adolescent side, and then on the older side of the age range, usually those folks are treated with people who are in their 60s, 70s, 80s. So, they also feel out of place because they're having to navigate work, whereas maybe most people are tired or they're having to navigate what are my kids going to do if I'm no longer here. And maybe 60s, 70s, 80s, those kids are already out of the house. So, it's kind of this, it's a big age range, but it's kind of the amorphous middle where you're not in either end, but most of the patients we see fall into one of those ends. So I forget what I was saying about that. So, but yeah, actually, okay.
Yeah,
So
you were
yeah, so
talking about how you were 7, not
yeah,
yet in the age range that you currently study.
yeah. So not so a little bit of an insider outsider. The reason I was drawn to this age range is there are a lot of really cool for a researcher, not really cool for the people who are experiencing it. Kind of psychological questions about, identity, developmental challenges. So all of the things that normal, adolescents and young adults, they're experiencing, establishing social relationships outside of their family of origin. They're trying to, move out. They're trying to get a job, decide on a, career, decide on a life partner, that kind of thing. So those are all like really interesting, like psychological, they come with a host of psychological demands that cancer just completely interrupts. And so even though I wasn't in that age range, those were the types of questions that I thought were really like fascinating. Like, how do you navigate the two things? And that's something that I felt even though I was so young, in some regards and didn't feel in other regards. So I would say that, having this experience and doing research on it, it's really an insider outsider where, um, I do rely a lot on my experience to kind of drive my research agenda or my research program. But there's also a lot of times where I'm stopping and saying, let me get somebody else's opinion on this, preferably an actual patient. Um, or let me make sure, do a small survey so I can make sure I'm like doing, um, kind of following what the current needs are. Because the landscape has changed a lot, both in treatment capabilities, insurance, like all of the like related things that has also changed a lot. Um, so yeah, I would say it's definitely really important, because I do feel like participants respond to knowing that I'm a survivor, um, that I'm a part of the club. I kind of get what they're going through. Um, but also, I mean, obviously, as a scientist, I want to be careful about relying too much on that.
You said something very interesting. I never know what question to ask first, and so I'm gonna stick the thumbtack in one and hope that I can get back to it. But I think this is important for the audience to kind of understand working definitions. When you say a cancer survivor, what do you mean by that? Is that someone in remission, or yeah, what do you mean by cancer survivor?
That is a great question. And honestly, to be honest with you, everybody approaches that definition differently. So before I got my doctorate, before I started studying this subject area, I guess I defined it as, I'm off treatment, I'm surviving, right? But I also, as a young woman, um, struggled a lot with survivor. What does that mean? And that's something that we hear a lot of from people who have gone through cancer. What does surviving mean? Um, there's a lot of, oh, you're so brave, oh, you're so tough. Well, a lot of the times I would kind of just look at my husband and be like, you know, I really didn't do anything. I just took a bunch of medications and kind of hope they worked. Like, what do you mean I'm so brave or tough? Like, I didn't feel brave or tough at all. And um, so, so what does being a survivor mean? It's kind of a loaded word. So I appreciate that you asked this question. In my research, I use the NCI, the National Cancer Institute definition, and they say that anybody is a survivor from the point of diagnosis for the rest of their life. That's the NCI's like official definition. So we kind of try to stick to that when we're doing the research, just to make sure that we're kind of all working from that same frame of mind. But if you ask our patients or our participants, there's so much variation in what that survivor word means. We're actually conducting a study right now. Last year, we received a supplement to a grant that was already funded. So this is through my PI, Dr. Katie Devine at Rutgers Cancer Institute, and she has a grant, a multiple year grant about teaching some problem solving skills to to young adults. I'm sorry, it's just young adults newly diagnosed with cancer. So we got a supplement to that, which, we applied for to the NCI, and it's about transitions into survivorship care. And so by survivorship care, the NCI was specifically interested in, what kind of services are provided to people post treatment. But when we use that survivor word with our participants, there are a lot of variations on how people feel about that word. So it's a loaded word. I'm glad that you asked this question. And so so that's kind of how I would define it. But I think you could probably get 100 survivors in a room and get a different answer every time what that means. Some people really embrace it. I knew a breast cancer survivor in my hometown who did a lot of advocacy and work with pediatric survivors. And I can tell you more about that if you want. But she and I were the same age. So she would define it by the day of diagnosis. Um, but it was kind of like a rebirth kind of thing for her. So yeah, I really think it depends on who you ask. In my science, I really try to stick to the NCI definition just because it's kind of a easy frame of reference for everybody. But even I know among researchers, we have, the question on our minds, is this really the best definition? We're not really sure, but it seems to be kind of the best way to get everybody on the same page so far.
Oof. I've got to ask this because there's just so many nuggets that you're dropping, and they're just all so. All right, so this is the question that I have to ask. I said I was gonna stick a thumbtack in it, but I have to get back to it because you said something that was just I thought was just really important to come back to. You have mentioned now a few times that who you are and your own experiences, it can influence,
Mhm.
your pursuit of understanding. So I thought that was interesting, and I do want to hear some thoughts about that. Regarding oftentimes science and research is viewed as being just 100% like without bias, just all objective. But no matter what you research, it is filtered through this subjective lens of the person engaged in the research. That's what I'm hearing. And I just want to give you a chance to say your head's nodding. On speaker view, people are looking at me, so they might not see you nodding your head. So, but I wanted you to maybe say a few thoughts about, because a lot of folks don't completely understand research, the scientific approach, and the impact that the researchers themselves have on the questions and so on and so forth. So could you touch on that just one more time for us, please?
Yeah, and I think it's also a really important topic to address head on. Especially in this day and age, we've had you know, I suppose I should start by saying, I all of my education has been in a school of journalism. So this idea of subjective, objective, this has been my entire academic life, professional life, all of that good stuff, right? So I think it's very important to have the conversation about subjectivity and objectivity. Um, in research, I don't think that there is ever a time actually in any endeavor that you can be truly without your own personal influences, right? Like that's something that we know from psychology. Everybody is the expert of themselves, right? So we're all filtering all of these inputs against everything that has ever happened to us, for us, by us, with us, all of that stuff, right? We're all kind of processing it through our lens of Meredith Collins, our lens of Richard Watkins, right? Like that is how inputs get processed. Um, in science, one of the things I love about science, especially, is the interdisciplinary um, nature of it, and B, the team science. So I would say, right now I'm a postdoc, which means that I've completed a doctorate, I'm a PhD, I'm kind of in that middle stage where I'm not quite independent. I'm still with a mentor. I'm still getting mentorship. I'm still having a person where I can bounce questions off of and all of that stuff. Um, so I guess to say it's still a little bit like school in that I'm working with my mentor, but I'm primarily the only one on my projects right now. But in once most projects happen in a team. And what I like about the team is that it, I think that multiple perspectives make it less subjective, right? Because you have Meredith saying one thing, and then you have Richard saying, well, actually, like maybe we should think about it this way because XYZ. Everybody on a team brings their own experiences, knowledge, all of those things. So one of the things I like about science, especially science in the AYA area, is everything happens in a team. And I love that because I think it makes us, I don't want to say less subjective because we're all bringing our experiences to it, but I think it makes for stronger science because we're all bringing our experiences to it. We are all, you know, bringing in, my experience as a survivor. Well, my mentor, her sister had cancer, right? So she's bringing in her experience as a sibling, as a family member. And then there are some people who are just really interested in this but have no personal experience, or maybe they have a grandparent or whatnot. I went to a conference in March, and the researcher presenting on the topic was like, you're wondering how I got a group of Black men to talk about prostate cancer, right? Because I don't have a prostate. And the way she said it was just really funny. We all laughed. I mean, and it's just we're all bringing in these different perspectives. Um, and I think that's something that makes our science really stronger. And so, the team who's conducting the research is also almost always reviewed by another team of people reviewing the research. So when we're trying to get grants, all of that, all of those applications are reviewed by a panel of experts, and multiple people have to comment on how you said you were going to do this study, why the study is necessary, where all that money is going. Like there are multiple people saying like, yes, this is a good idea. And they bring all of their backgrounds and knowledge and experience and knowledge of the literature, like knowledge of what's come before. So, and then when you go to publish, you have at least two or three, sometimes more people reading it and saying like, yeah, like this makes sense. This was like a study design that, is scientifically sound. These conclusion, the data that's presented matches what the authors are saying about it. So one thing when I think about subjectivity is we all bring our own experiences, but we have so many other people that we're running it by that it's much bigger than any one person. Um, and that's, and that's not even bringing in our human participants, right? Our humans who have this lived experience, who are giving us real-time feedback on surveys, experiments, interviewing, whatever. And that's something I love about science. It is our own experiences coming in, but there are so many others that get thrown into the pot to make it more applicable to everybody else. And then also, making sure that we're doing things that are scientifically sound and that serve the community that we're actually trying to help. I don't know anybody who goes into cancer research who genuinely does not want to help a person. Um, at least one who's experiencing this, very, very tough challenge.
One of the things that I picked up on in my scientific training, and it's something that I didn't know was going to be so important, and that was to be very open and very honest when you don't know something, right? You are trained to be transparent in your ignorance. Don't pretend, don't try to make up answers. So I'm going to take heed in the real time on that training and say I'm ignorant or I might have missed this, and this is an opportunity for us to, because I think it's important. Your PhD is in what specifically? Not the question per se, but your PhD is out of what discipline?
My PhD is in mass communication. And I love that, honestly. And I also hate it because sometimes I'm like, I'm just the media person over here. And so mass communication is, the study of mass communication. So, I had people in my program answering questions about like, what is political coverage? How does that affect people? Um, Somebody, I told you the other day about somebody who did their PhD on like podcasts, and their effect on people. So it's a really kind of wide ranging discipline. And sometimes I'm like, oh, like, how does this relate to cancer? But within mass communications, we have a media psychology tradition, we have a health communication tradition. So, like, communicating, they're kind of sub-disciplines, but not enough that you can get like your own doctorate in them. So it is a little nebulous about how it all works. But you know, we have those two really like strong kind of traditions in mass communication that I would say was the bulk of my actual education. And then a lot of that is translatable. A lot of it borrows from other disciplines like psychology and public health. So in my program, we were encouraged to take classes in other departments. And that's kind of how I get to pull in some of those interdisciplinary and then work with experts who took all their classes in that interdisciplinary. But it is um, it is true. I mean, like my doctorate says mass communication in my uh, degree that's hanging on the wall.
That's awesome. That's awesome. Again, we're talking to Dr. Meredith Collins, postdoctoral fellow at the Rutgers Cancer Institute. And again, thank you so much for being with us. The reason why I asked that question, because it's so important, especially for individuals who are working to grow as professionally, academically, career wise, that there isn't always a specific and exclusive pathway to addressing an issue. And I just thought that was just, I talk to folks all the time that say, I can't do that because I did not do this, or because I did this, I must do that. And that was huge. Thank you so much. But let's get right into kind of like the meat and potatoes of what you do. I'm interested, how did you how do you come up, how does one come up with research questions compared to like a master's, a PhD program, and now you're a postdoc? You talked a little bit about the relationship that you have with mentors and how you're now developing more um, independence as far as, intellectual independence over the questions that you're asking. I guess take us to the workshop of how a question is developed in regards to the psychology of a cancer survivor, especially with such a broad age range. How do you come up with a question?
Yeah, I think that's a really good question, not to just say question a bazillion times. But how I like to approach questions, I like to start and was taught to start with what's already been written. So what do we already know? That's where I like to go first, and that is where I keep a list of running questions. Most researchers I know have a list of running questions that maybe they'd like to answer someday. Um, and so whenever I read a new scientific article and I have, we all have thousands of them in some folder, right, on our computers. So whenever I read a new scientific article, I'm taking notes. What did this one find? And then I'm thinking in the back of my head, is this the same that most of the other studies I've read have found? Is this different? If it's different, how is it different? Is it different for like a certain population, or is it or like a certain part of the population? Like there's definitely been some movement in trying to separate that age range because it is so wide. So some people are focusing on one part of the age range or another. So sometimes that's a like a good area to note a difference. So basically, I'm looking for differences, and I'm trying to connect the dots in my mind, right? What do we already know about this topic? What does this study add? And then, um, how is the research conducted? So do I think that, this data is because of what they, how they design this study? Sometimes, um, you design a study and you kind of know that maybe you're only focused on this one part of it because you can't do everything, right? You don't have money, you don't have enough time, you aren't going to get enough participants. So um, there are there are sometimes decisions that are made, and the authors will acknowledge that usually when they write up the study. So I'm thinking, I'm looking through that literature, I'm thinking about that in the back of my mind, and then the other thing I do is listen to participants in the research that I'm already conducting. So I'm listening to what participants are saying. We're doing interviews about this transition to follow up care. Well, what are they saying? Does that usually a study brings up more questions than it answers, right? There are endless questions. So we learn a little bit more about the question we thought we were going to answer, and then we get 6 more that we could do. Um, so so a lot of that is how it starts, right? When you're in your master's, when you're in your PhD program, the most important part is reading, is finding out what's already happened, because that's the whole point of the education, right? Like, you're coming up to speed and you're
Well, let me
learning how
jump in
to
there
ask
really
these
quick.
questions.
Dr. Collins, I'm so sorry to jump in there. I just have to ask this quick question.
Yeah,
What do you read? Right. I think it's important. Um,
good question.
right. I'm not now, this is one time where I'm pretending to kind of not know the answer. I stopped you right there because I was like, all right, this might be important. What are you reading when you really want to know? All right, what's really known about that? What are you reading?
Yeah, so to know what's really known about that, I'm reading scientific articles. So things that other researchers, the studies that other researchers have conducted. And then after you conduct a study, you write up the results and you try to publish it in a scientific journal. So those are journals that publish research. And, you uh, when you submit your manuscript, which is, the write up of the research, an editor looks at it. Usually two peer reviewers look at it, which are other academics, and they're, looking to tear apart your argument, right? And then usually they'll give you suggestions about ways you could improve the paper, the writing. It's not clear, we don't understand, and then you uh, try to make those changes, and eventually everybody's like, okay, yes, now we can get it published, now we can publish it. And um, so academic journals I read a lot are like Journal of Adolescent and Young Adult Oncology, um, Journal of Cancer Survivorship, media psychology I read a lot because that's where my media stuff hangs out, or health communication, Journal of Health Communication. They publish on so many different topics within health. So all of those are some of my go-tos for finding out what other researchers have written. But I will say I do also, I was a journalism student, right? So I'm reading a lot of news as well. Like NPR has a series right now that they're doing on cancer and cancer survivorship and how cancer is affecting young people. And I do get a lot of kind of questions from reading news articles. And sometimes, when those questions come up, I'm like, okay, what do we know about this? And like, is this something other people are experiencing? So maybe I'll ask one or two kind of questions within a study that we're already doing, if there's room and it all works out, because we do have to get all of our, we do have to have our whatever we're doing approved by the IRB, just to protect our participants. And, so all of that is really important. So yeah. And I mean, I love fiction. I love reading fiction. I like writing fiction. So I'm also just always reading fiction. And sometimes, inspiration strikes in the most unlikeliest of places. And so that can also sometimes be a source of inspiration.
Uh, IRB, Institutional Review Board,
Yes.
uh, created just to ensure correct me if I'm wrong, the ethical treatment of test subjects and the information and data that comes from those test subjects as well, right?
So the IRB is the Institutional Review Board. Some places also call it a Human Subjects Review Board. And it's basically just anytime that you use humans, it's a third party opinion on whether treating those humans fairly and ethically. So you kind of, what the information you give them is, here's what I plan to do with my human subjects. Here's, the consent form I'm going to give them. Here is how I'm, what I'm asking them to do, including here are the specific questions I'm asking them. Here's how I'm going to protect their data. So all that data that I get back, here's how I'm going to protect it. Here's how I'm going to report on it. So am I de-identifying? Am I making sure that, if somebody is able to hack my computer, that they don't get, that response 10 is Richard Watkins. So all of that stuff gets sent to a reviewer, an IRB reviewer, and they look at it. And, usually I don't think I've ever had one that didn't come back and say, hey, we have a question on this. Can you either clarify that or can you make sure you're doing this? Um, a lot of the times it is clarification, but the whole idea is just to make sure that people are treated fairly and ethically when they participate in research. And that's really important um, to everybody that I've come in contact with. And to me to make sure that we're asking people to give us their time and their talent of experience, and we want to make sure to treat them fairly and compensate them appropriately, and take care of them as much as possible, which is sometimes fun when you're doing deception studies or studies where you can't quite tell them exactly what you're doing before they get there.
Yeah, like the person that is being electrocuted on the other end of the wall is an actor and not. I think I'm referring to Stanley Milgram, who I think
Yes,
influenced the creation of the IRB. I mean, that wasn't the
you are.
intention, but the outcome I think was like, wait a minute, we need some standards in place.
Yes.
Let's. What have you found in your research to be important from a media standpoint? If I'm misunderstanding your question, please forgive me. The questions that you're asking, what is important from a mass media standpoint and an interaction with social media? What's important for adolescents who are survivors of cancer? What are some things that you've come to discover?
So I think the first thing that I would tell anybody about um, cancer survivors interacting with, and I focus primarily on entertainment media. So what I mean by that is, like I said, I love to read fiction. So my focus is primarily on fiction. So I'm not necessarily talking about reality TV. But I kind of focus on stories and narratives, and anything with a beginning, a middle, and an end can be a narrative. And actually, whether it's fact or fiction, there's actually been some research to show that people process the information the same, whether it's labeled as fact or fiction. Um, so I'm focused on how do these movies, TV shows, books, how do people process them? And then can we use some of that processing to kind of focus their processing on cancer? Um, and so for my dissertation study, I just wanted to know if people were doing this. Like, am I out in left field? Am I totally off base? Like, is this just me? That's actually how a lot of psychology research gets started, right? Was this just me? Or at least that's the joke. I don't know. I can verify that for me, a lot of my research does start with, is it just me? But I can't speak for everybody. Um, so and I found that, I did a survey. I recruited people who had survived cancer through Facebook, and I recruited them through a service called Prolific, which maintains like a panel of people who have agreed to research in exchange for compensation. And they actually had a cancer survivor filter. So I was able to target my invitations to people who had reported surviving cancer. So I found that about a third of that sample um, said that they were using media to process something about their cancer experience. And in interviews I had done as a subpart of one of my dissertation mentors' research studies, we talked to, I want to say, 45 young adults who had survived cancer. And I asked them about seeing cancer in an entertainment storyline. When you see it, you turn it off, do you keep it on? Like, how is that? And results were kind of mixed. Some people enjoyed seeing these cancer storylines because it validated their feelings. And some people were like, no, it's too soon. It's too close to home. It makes me nervous. It makes me worried about my future, so not blah, 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 but etc. Um, and so we had kind of a 50-50 split on do we like seeing cancer storylines? And we kind of had about a third of people saying, hey, I'm seeing something in narratives that are helping me cope during my cancer experience. Um, so that's kind of where this started. My current project, which, like I said, I'm like in the very early stages of collecting data, so I actually don't really have anything to share, but I am going to prompt them to watch 10 minutes of a movie that I chose, and I can tell you how I chose that movie in a minute. And then they're going to have a conversation. So I'm giving them basically like a discussion guide, like a book group guide where they're going to talk about the movie after they watch it, after they watch the 10-minute excerpt. Um, and we'll see how that goes. My question is, can the movie help be supportive? Do young adults think that that's acceptable? Is it something that they feasibly could see themselves doing? So when we talk to them, it's not so much about the conversation, but about the experience of having the conversation. And we just want to know if this actually helps. Like that is the question. Is this, I think I've called it a tree worth barking, a road worth going down, a tree worth barking up. And so that's kind of the question that's on my mind right now. And then hopefully it is a tree worth barking up or a road worth going down. And we can kind of take that to the next step and develop maybe some materials and some guides to help young adults navigate that conversation when they're interested in having it. I like to think about all of the resources that I'm interested in developing as plug in, plug out. When you feel you need it, have the capacity to handle it, you plug into it. If it's not for you, if you can't possibly add something else to your plate, you don't have to access it until you're ready, right? So very user friendly and user chosen and driven. And I would say that is also something that I learned a lot in my mass communication background is how to really center the user in design of anything that I'm thinking of doing.
You spoke about you were going to tell us how you chose the movie.
Yeah. So how I chose the movies. So I last did a content analysis of 20 movies that featured a young adult person battling cancer. And so I had some criteria for how I was going to pick these movies. And that's how I got to the number 20. I wasn't like, I'm going to stop at 20. No, I only found 20 that met the criteria. So it was released during 2014, no, 2014 to 2024. Yes, released in the past 10 years was essentially the idea behind that, that it featured a young adult facing cancer. So no, pediatric or older patients. And that was probably the hardest part to determine because some of the characters were not clearly aged, especially the young adults. So in that case, I had to make a decision and I used that actor's age as a stand-in for the character's age, which, given sometimes how they cast older women as younger women, you could maybe question that, but it was the best that I could think of at the time. And still right now, I can't think of a better way to do it. And then, so it had a cancer storyline and it focused on cancer. It wasn't like a side character. It was the main character or one of the main characters. Um, and I believe those were all US based. So you know, we have very unique situation with our healthcare system. So I was really just wanted to focus on the US because that's, who I was going to be interviewing, showing the movie to and talking to afterwards. So that came up with a list of 20 movies. and we analyzed them for, what types of medical things that they showed, and then also what types of social things that they showed these characters with cancer facing. And we then created, a number. So, say The Fault in Our Stars was in the list. So, say, there were 30 social challenges, there were 10 unique ones, and they repeated some to come up with this 30 number. So we averaged it out, is what I'm saying. And we picked the one with the highest average of social challenges because we were going to be asking about social challenges in the next part of the study. So we ended up picking this movie called Hope Springs Eternal, which I had never heard of before I conducted this study. And then we're looking at the first 10 minutes of the movie, which actually have 3 different social challenges. And by social challenges, we were kind of looking at how the character interacts with their social world. So with other characters, with friends, family, school, if they were, in school in the movie. So how that, interaction and what some of those challenges look like. And for that, we really did go to the literature, what has already been written. So there have been a lot of really great in-depth interviewing studies with adolescents and young adults about what some of the challenges they face with people their own age, their siblings, their, parents, teachers, just the world at large. There's been some really great studies. So we kind of use that as like the basis for the coding that we did. And so that's how we picked the movie. So we'll see how it goes.
This is absolutely amazing, and obviously, I want to be very mindful and respectful of your time. This has gone by like that because it's just so incredible, the work that you were doing. And so, if you permit,
Absolutely.
can I ask a few more questions, and then the final kind of wrap up question will, where I kind of give you the opportunity to put the ball in your court a little bit. It's all good. I do the same thing at the end of every single episode. But before we get there, so one of the things I thought was interesting, and this is based off of something that you just said. Um, do you think that there could be, and I don't know how to properly phrase this, so I'm just going to just ask it. Do you think there's a difference between what someone says that they need and what they might actually need? I'm thinking like you said, seeing a survivor's experience depicted in entertainment, if I understood it correctly, it's kind of 50-50. Could there be a situation where someone may feel that it's not for them, but in reality, it might be good for them to actually check it out, despite how they might feel about it? I don't know if I asked that right, but I'm trying to get at you know what's useful for folks versus what they feel is useful.
Yeah, I mean, I think that that's a really good question. I think that that's, yeah. So it was 50-50 that they, wanted to see it, right? Like, and I do think your question is a really, it's a good one, right? I mean, because if we think about ways that people cope with challenges, usually avoidance coping is not actually helpful, right? Like usually people who use avoidance coping by avoiding the topic um, tend to have lower, psychological like quality of life. Um, so more distress, all that kind of stuff. Um, and, I will be the first to raise my hand and say I did avoidance coping for a long time, and it was not a good idea. I think I have shared that kind of far and wide. Um, but I do also think that there is, you know, there is a time and a place um, for kind of taking it head on, and there's also kind of a time and a place to be like, I just can't do I can't right now. Uh, and so I do think when we talk about psychological interventions, a lot of times the thing that is on people's minds is there a trained professional like kind of nearby? I'm working with a different faculty member at Rutgers, and we're doing this single session intervention for siblings of children with cancer. And we were doing some interviews with potential, stakeholders, so parents, people who provide services to these families. And a lot of times the question was, well, is there going to be a psychological provider like on standby? And it's really no, these are, kind of self-directed and these are self-directed and not a replacement, but if you're on a waiting list, this is a good activity to do, or you can kind of use this as a stepping stone. um, and I kind of like to think of it like that, like that you know if it if there's always a place for professional help if you would like it. um, and I don't want to make anybody engage in any kind of intervention that they don't want to. But I am hoping that anything that I develop, we get enough input. And I mean, by I say I'm hoping, this is the plan, right? We get enough input from the community that there is a way to do this where we are being respectful of the fact that, sometimes people need a little nudge, but also not overly prescriptive on what they should or shouldn't do. People generally know what they should or shouldn't be doing. And there's a variety of reasons they do or do not do it, right? So we're trying to make this, and by we, I mean me right now, a wider team, the whole thing, I think the intention is always we're trying to make these things available. We'll never force anybody to do them, but we want them to be as helpful as they possibly can be. Um, and it's another resource offered in a sea of resources, of course, and um, that they can kind of come to it when they're ready to engage. But we're not going to force somebody. Sometimes you have to come to the table and ask for the water. I guess, modifying the old horse analogy. Um, but but yeah, I mean, I do think that there's value in some of these nudges, and we did have a study where, you know, some of our participants said we wish we had asked for peer support sooner. Um, but they usually didn't use it until way later in their treatment trajectory. Um, but I mean, definitely not going to make anybody do anything they don't want to.
All right. And so this is my last question before my promised turning of the tables. And again, we're talking to Dr. Meredith Collins, postdoctoral fellow, Rutgers Cancer Institute. And I think this question is, I don't know, I feel like it's perfect for you. I don't know. Okay, so again, this is me just struggling to ask a question and don't know how to ask it, but I'm gonna ask it. What is the difference? And I'm looking down because I wrote it, and as I'm like reading it, I'm like still trying to formulate it in my head. What is the difference between a psychological provider and a mental health provider? What is the
Oh,
difference between psychology and mental health? I sometimes I just don't know the difference. And as somebody who focuses on communication, I feel like you're uniquely positioned to address that question.
okay. Um, okay. So I should start by saying maybe also a little bit of ignorance on my part. I don't know what the formal definition of the difference is. So anything that I'm about to say is really my perception, which, yes, is informed by my training and my understanding of how these fields work together. But I don't know that anybody, I don't know that I've ever read a definition or that I could say with 100% accuracy that what I'm about to say is even the most correct version of the answer. But as you were asking the question, which I do think is an important question, right? When I think about a psychological provider, I'm thinking about somebody who is trained to provide psychological services. And yes, I realize that that's mostly just the words in the question. But I'm thinking about, a clinical psychologist, a licensed clinical social worker, you know, um, even, like an art therapist. I'm thinking of all of those people that kind of have a formal training around providing like clinical services. Um, so I'm thinking that every mental health provider or every psychological provider might also be a mental health provider, but not every mental health provider is also a psychological provider. And the reason I'm going to say it that way is because we do also, UNC has an expert who I took a class with, Dr. Ed Fisher, about peer support. And one of the things that you can do with peer support is have like community health workers or lay health workers or peer educators. And those are people who are trained to do something that, is within the purview of the program. So a lot of the times that is or, in underserviced areas, maternal health, or I'm trying to think. I mean, a lot of programs are like maternal health or like infant health. So other women supporting women who are new moms. But um, but mental health is also a big area that can, or substance abuse. You can have peer or community health workers. Um, so which is also kind of mental health. Sorry, I do talk a lot, so I apologize. I by my questions. Anyway, so I would say that that's kind of the difference in my mind is that, a mental health worker could be a peer. It could be somebody who, yes, has gone through some extra training than just your average person, usually has some kind of personal experience. Um, or just somebody really interested in the topic with that additional kind of education training program, but maybe not to the level of a formal course, a formal master's, a formal, kind of certificate in whatever their specialty is. Um, that's kind of the difference that comes to my mind. But again, I will admit my ignorance. I am not 100% sure that that is the definition, but in my mind, that's kind of where I'm thinking the line is.
Yeah, I had to ask because I think there's like, real world ramifications about the how do I say it, the lack of a concrete definition because it impacts the services that people are offered, people can afford. And at no point is it really like this is this and this is this. And yeah, so that was really important that you said that. Um,
Yeah. I
so
will
what? Go
I
ahead.
will
Sorry.
add, if I may, one thing is just, we obviously know that we have a lot of people who could benefit from mental health services in the country. And there's not enough providers, right? There are waiting lists, there are never enough providers. So I do think that um, as a I'm not in the provider speak, but as who is kind of in this area of research, I really think it is important to think about um, how we can really, maximize the providers that we do have, and, give the people who are looking for help and who need help the most help that we can get them. So I do think that that's a really important question, um, because I do think that, my expertise is in social support, partially also, and so thinking outside the box and thinking how we can help community programs as well as, those licensed people is I think really important for the future of just mental health in general.
So last question, as I promised, I have the opportunity, the luxury, the honor, and the privilege to talk to, I mean, the most brilliant minds arguably in the world. But it's a gift and a curse because there's no there's never enough time. I can talk to you for a week on end, and still there's questions that remain unanswered. And there's going to be an audience member who's like, you never asked them about this question, or you might have been prepared to answer a question that you never received. So, I guess with that being said, I want to give you this opportunity with this final question. What question should I have asked? And then provide your answer to your own question.
Oh my goodness. What question should you have asked? you know, I'm not, I mean, I guess I don't know if you should have asked this, but I do think out there somebody's probably like, well, how do I support an adolescent or a young adult going through cancer? And, I wanna first off say that it's okay for it to be really awkward and clunky because they're just looking for you to show up. There, you know, there was a research article I read a couple of months ago that was like, you know, giving undesired support is better than not giving any support at all. Um, and so, the best way to support an adolescent or young adult going through cancer is just to show up. And I think people are so afraid of saying the wrong thing, and there are plenty of wrong things you can say. Don't get me wrong, but showing up is kind of one of the things that folks consistently tell us that they want, and so I think it doesn't have to be a lot. It can be a text message. It can be a meme of a funny animal doing a funny thing. It can be a video of your pet doing something. I don't know, whatever the person in your life is interested in. And so I think the other thing that I will say to that, showing up is the most important thing. And also it's really hard. Like this is literally my area of expertise, right? And I had a friend in a fiction writing group go through cancer at I mean, I guess at the start of the pandemic. And I felt like I should know what to do, right? I of all people should know what to do. I felt like I had no idea what to do. Um, and I was kind of waiting for them to tell us, how we could support them. And, I feel like don't wait for the other person to tell you, so to speak, because they might not know what's going to be helpful. So just knowing that you're thinking about them is incredibly helpful. And so I think that impact, it can definitely be overstated, but it's also, the best way to show up for people in the beginning. And by beginning, I mean once once you keep showing up for people, they're gonna start at, they're gonna know that you're there and that you're willing to do whatever they need. So um not not necessarily the beginning of treatment. I will also say that cancer treatment is a can be a really long haul. So show up on day 1, show up on day 100, show up on day 365, and so on and so forth. I was in treatment for 2.5 years. And while I wasn't hospitalized for 2.5 years, it's a long treatment. You weren't out of the clear until you were, you weren't out of the woods until you were out of the woods. So I think sometimes it's easy also to forget how long it is. So I guess those are my three pieces of advice. You're not alone in not knowing what to do. Just show up. And it's a long haul. So don't forget to show up after day one too.
Dr. Meredith Collins, postdoctoral fellow at Rutgers Cancer Institute. Thank you so much for your work. Thank you for your service. Thank you for taking the time out of your day to be with us here on the Richard Watkins podcast. We really, really appreciate it. Thank you.
Thank you for having me.
And for each and every one of you tuning in, again, whether it's morning, afternoon, evening, thank you so much for being here. The Richard Watkins Podcast is a proud production of the Science Policy Action Network. Check out all those episodes and see how the Science Policy Action Network can help you at www.span-inc.org. And remember that the future is not something to wait for, it is something to build. Thank you all so very much. Have a great day.